Episode 9, Ribavirin and Microclots. Can it address endothelial dysfunction? Welcome to Ribavirin and Reminiscence and Lingering Load in Long COVID-19, where we delve deep into the legacy and potential future of Ribavirin in the age of chronic COVID. I'm your host, Anushka. Today's episode takes us into one of the most intriguing and unsettling hypotheses in long COVID research, microclots. These tiny, persistent, fibrin-rich clots are believed to contribute to symptoms like brain fog, fatigue, and breathlessness by disrupting microvascular flow. But here's the twist. Could antivirals like ribavirin play a role in addressing this problem by targeting upstream triggers like viral persistence? To guide us through the vascular side of virology, I am joined by Saakshi, a microbiology expert with a keen interest in post virus interactions and post viral recovery. Welcome, Saakshi.
Thank you, Anushka. Microclots are a fascinating but tricky topic, and I'm excited we are digging into the nuance today.
Let's start at the very beginning. What exactly do we mean by microclots in long COVID?
Microclots refer to small, resistant fibrin deposits that can persist in the microvasculature. These aren't just regular clots, they are stubborn and biochemically odd. They are resistant to fibrinolysis, the body's natural process for breaking down clots. What's fascinating is that they're often found in plasma samples of long COVID patients, along with elevated endothelial markers and platelet activation.
So these are not just tiny clots, they are sticky, almost like biochemical superglue, disrupting the flow of oxygen and nutrients in our smallest blood vessels.
Exactly. And because of this, they can obstruct oxygen delivery in the capillary beds, which can contribute to further symptoms like fatigue, brain fog, and even chest pain.
What's the leading theory on why these clots form and persist?
There are several theories, but one of the leading ones is that residual viral particles, or RNA, are keeping the immune and endothelial systems in a low grade inflammatory state. This can cause platelet hyperactivation, or endothelial cell damage, or excess fibrin production, and even inhibition of fibrinolysis. Some believe autoantibodies may also be involved, but persistent viral reservoirs seem to be the primary suspect.
Now, let's bring ribavirin into the mix. It's not an anticoagulant. So, how might it help with microclots?
Great question. Ribavirin does not directly affect clotting pathways, but here's the hypothesis. If these microclots are driven by persistent viral antigen and ribavirin can help suppress or eliminate that viral reservoir, then you're essentially cutting off the trigger. The idea is this: no virus will lead to less immune activation, which will further lead to less endothelial injury, ultimately leading to fewer clots.
So, ribavirin acts as an upstream intervention, cutting off the fuel that's feeding the fire.
Exactly. Think of ribavirin as indirectly anti-thrombotic because it's working directly as an antiviral.
Do we have any solid evidence that ribavirin actually reduces clot formation or helps endothelial function?
The direct evidence is sparse, but there are some hints. For example, in Lassa fever, where vascular leakage is a major issue, ribavirin has been shown to reduce mortality and vascular inflammation as well. There are also animal studies wherein ribavirin reduced endothelial cytokine expression. In acute COVID, combination therapies that included ribavirin seemed to report fewer thrombotic events. But again, there's nothing definitive yet. So it's plausible, but we need more research to confirm it.
Would you ever consider combining ribavirin with anticoagulants or antiplatelet agents in long COVID treatment?
That's a really interesting idea. Some early protocols have combined low dosage anticoagulants with antivirals or immunomodulators in acute COVID. In long COVID, combining treatments would be risky without careful monitoring. But if we had biomarkers for viral persistence and clotting risk, then we could create a personalized combination therapy that might be transformative.
What are the risks of pursuing ribavirin in this context?
There are quite a few. Ribavirin has known hematologic side effects, that is, it can cause anemia, which worsens fatigue and impairs oxygen delivery. Additionally, long term use without clear viral targets could be counterproductive, especially in patients already struggling with energy deficits and autonomic instability.
So, as always, treat with caution and ideally in a trial setting, right?
Exactly. And screening is essential. You cannot assume that microclots equal virus and automatically treat with ribavirin. We need solid evidence to support that treatment logic.
Saakshi, thank you for joining us today. This has been a fascinating dive into the vascular side of long COVID, viral reservoirs, and the potential of ribavirin.
My pleasure, Anushka. The vascular side of long COVID is still an underexplored frontier, and we need both creativity as well as caution as we further navigate these complexities.
Next time on ribavirin reminiscence and lingering load in long COVID 19, we'll explore how ribavirin modulates cytokine release, T cell response, and inflammation. Can it influence immune dysfunction in long COVID? Until then, I'm Anushka reminding you to always look deeper than the data and listen to the biology.